And good afternoon, everyone, and welcome to another episode of Ask a Doctor. I'm Nizar Wehbi. I'm the North Dakota State Health Officer, and I will be the moderator for this episode. We are so fortunate today that we are joined by three outstanding physicians that will go through the questions and will inform us about COVID-19 vaccinations as well as its relationship with fertility and pregnancy. So first we have Dr. Anna Tobiasz. So I'll turn it to her so then she can introduce herself and tell us a little bit about her specialty and expertise. Anna?
Okay, thank you, Dr. Wehbi. I'm Anna Tobiasz. I'm a maternal fetal medicine specialist here at Sanford in Bismarck. I've been here for about 4 years, and so I practice in caring for women that have high-risk pregnancies. So helping moms with their health care and then also with care for the baby as well.
Okay, thank you. And I think Dr. Foughty and Dr. Broadwell will be joining in a few minutes, but we can kind of start with a few of the questions that we have received related to pregnancy and how pregnancy is related to COVID-19 vaccinations as well as infections. Oh, and I see that Dr. Broadwell already joined us. So hello, please take a few minutes to kind of share with us what you do and your specialty and your expertise.
Yes, hi, thank you so much. Oh, I can't believe I'm connected. Yay. Hi. So my name is Christina Broadwell. I'm a reproductive endocrinologist here at Sanford in Fargo. So kind of area of expertise absolutely is sort of helping kind of women and couples kind of navigate kind of reproductive health with and that can encompass kind of regulation of menstrual cycles, any difficulties that may require any workup due to trouble conceiving, treatments to kind of help couples or individuals conceive. That can include, medications, procedures, and things like in vitro fertilization.
Great, thank you, Dr. Broadwell. So let's start with the questions. So the first question that is on the mind of many individuals is, does COVID itself affect pregnant women more than the rest of the populations? Are there any additional or other complications that are posed to pregnant women versus the rest of the population? And I'll turn it to Dr. Tobiasz to start with, and maybe Dr. Broadwell, you can chime in as well.
Yes. So fortunately, overall, the risk is low. However, pregnant women are at higher risk of complications if they get severe COVID disease. Much like if a pregnant woman gets influenza, she has a higher risk of complications. The same is true for COVID-19. And this risk would be higher, if a woman has underlying medical concerns, they would be at even higher risk than just a low risk pregnant woman.
Dr. Broadwell, you were kind of like nodding your head. Anything to add or?
No, I think, yep, absolutely agree that we can see that there are different conditions that can increase the risk of having severe disease, and pregnancy has been identified as one that can result in hospitalization, need for admission in receiving intensive care. But again, overall risk is low in pregnancy. I think one thing that has, from kind of my aspect, is that there's not a whole lot of data, although we don't see an increased rate in early pregnancy. I think a lot of those complications we're seeing in later pregnancy, in first trimester infection. I think we're collecting data and trying to learn more, but there hasn't been a lot of information about impacts in the first trimester. And as thus far, that we don't see an increased rate of miscarriage occur with COVID infection in the first trimester. Although again, sometimes absolute time of pregnancy, what trimester that the COVID-19 infection occurred is sometimes not always available, but so far we don't see any association like that.
Okay, thank you. So one other kind of item on the mind of many, and that might go to you, Dr. Broadwell, is whether there is any relationship or issue or impact with COVID infection and male fertility.
Yes, and that's an excellent question, and I think the concern too is, can COVID infection impair sperm production that could make then conception more difficult in the future? And I think that really the studies that have been released thus far on this are kind of there in disagreement. One showed that there was, after COVID infection, a decrease in sperm parameters, that being concentration of the number of sperm, how the sperm were moving. And that, right, that function and number can lead to kind of ability to conceive. Another study didn't show any decreases in the overall count, motility of sperm. You know, now that being said, there can be different severities of COVID infection. There are mild presentations and there are more severe presentations. And there are case reports of severe illness requiring hospitalization, intensive care, admission. We can see lower rates of sperm production, but again, that can be the case with any inflammatory process that is systemic and is causing a lot of stress to the system. So I don't know that that's unique to COVID. The work that they've done, again, I think we don't see kind of that causation, but it's something that we're continuing to investigate.
Okay, great, thank you. So maybe let's kind of discuss a couple items that are more related to COVID vaccines. And the main questions that we always kind of like think of, would the vaccine pose any risk to the embryos, or kind of like, you know, the pregnant women or the fetus, let's say, and how is that related to, you know, unborn children, as well as whether it has a different consideration based on the trimesters?
So to date, you know, of course, there's no clinical trials including pregnant women yet, but there has been reassuring data from animal studies, as well as just kind of observations from the CDC VSafe and some other studies that have been done observationally. But with both the Pfizer, Moderna, and actually the Johnson & Johnson, there has been animal toxicity studies on this that have shown no harm with fertility, miscarriage rates, pregnancy loss rates, or congenital anomalies or birth defects. So we do have that, at least from the animal data. As far as ongoing pregnancy data, the CDC has been tracking women that have registered through the VSafe website or link. And so over 35,000 women that are registered have reported they were pregnant at some point when they had received the COVID vaccine. And they have now been studying around 4,000 of those women. They have a specific pregnancy registry for women that met the criteria and have enrolled. And so far to date, there has not been any difference in the rate of pregnancy complications when you compare to the general population that did not get just before the COVID vaccine, basically, so the year prior.
Sure.
And I think the only other thing I would add is there was recently a study published for our journal Fertility and Sterility out of Illinois that looked at women they looked at antibody studies to see if they were seronegative, that they had no exposure to COVID infection or vaccination. Those that were positive immunity due to infection or positive due to receiving the vaccine. And they followed those women prospectively and found that there were very similar implantation rates and ongoing pregnancy rates within the three groups. So I think that's very great data. Again, the numbers were small. It was about 130 women overall. But I think that's great information to show that after COVID vaccination or infection that we didn't see a reduction in implantation rates or ongoing pregnancy rates. So that was really great. Sure. And reassuring.
Mm-hmm. Sure, thank you. And I see that Dr. Foughty has joined us. So maybe I'll give you the opportunity to introduce yourself and tell us about your specialty and expertise.
Sure. Thank you so much. Sorry for being a little bit late. I had another speaking engagement. My name is Dr. Stephanie Foughty. I am a family medicine physician in Devils Lake, North Dakota. I also did a fellowship in obstetric care. So I do a lot of women's health. I'm also C-section trained. Here in Devils Lake, we do around 300 deliveries a year. And so I have a lot of experience that way. I've been in Devils Lake for 5 years. I also am the department chair here at the clinic.
Great, thanks for joining us. So we've been kind of like moved kind of like to talking about the COVID vaccines and whether it affects any pregnancy or even the embryos as they are being implanted or as they are developing. But sometimes you hear of individuals who have experienced a miscarriage shortly after getting their COVID vaccine. Sometimes there might not be any connection, but what is your experience when you hear about these anecdotal observations? And maybe we'll let Dr. Foughty start this time.
Sure, absolutely. So anytime we're looking at any adverse event that happens after a vaccine, whether it be miscarriage, stroke, even looking at death, it's important to look at the prevalence and the incidence of these cases. So what that means is when we look at the rate of miscarriage in the general population, depending on the resource you look, we know that somewhere between 10 to 20% of all pregnancies end in miscarriage. So when you look at people who have a positive pregnancy test, we know, like I said, about 10 to 20% of those end in miscarriage without any other factors involved. When we've looked at the reported incidence of miscarriage, when we're looking at the VFACT and the Veris data, it's in that same percentage range. It's between 11 and 13%. And so what that tells us is that there's no increased rate of miscarriage in individuals who have been vaccinated versus individuals who have not been vaccinated or who had pregnancy not related to vaccines. By comparing this, that is how we can scientifically say there is no increased risk. Yes, miscarriage can definitely happen, and it's a horrible thing for somebody to go through. And I think a lot of times women want to find a reason, and that's very understandable. But all of the information we've gathered from tens of thousands of women who have been reporting data to these information databases has really shown us that there is no link between miscarriage and the COVID vaccine.
Okay, great, thanks. Dr. Tobiasz or Dr. Broadwell, anything else to add?
Yeah, I think I just absolutely very much agree. And I think that this was a concern that I think made a lot of news when there was an executive from Pfizer that had warned about any potential cross-reactivity between the spike protein within the virus that this vaccine was developed to sort of target, and any sort of relation that had to early kind of placental cells. And really, there's been kind of even laboratory data that have shown that although there is a small piece of that protein that might look similar, it's such a small, minuscule part of that, and we don't see any cross-reactivity when they're looking in labs of kind of that antibody to the spike protein to that element of early placenta. So although that was one of the concerns that was raised from a prior employee at Pfizer about concerns, there's just been really no data to substantiate that.
Okay, great, thanks. So based on your kind of like experience and knowledge, whether through research or through following the clinical world, has you ever seen any correlation or causation in that case between COVID vaccines and any pregnancy complications or stillbirth, especially past 20 weeks, but during pregnancy in general?
Yeah, so I have many patients now who have been vaccinated against COVID either prior to pregnancy or during the pregnancy, and it is generally well tolerated, just as in the rest of the population. I have not had any adverse events in my patients that I'm aware of, and generally I would hear about it. So personally, I have not experienced any complications in pregnancy. And again, when you look at risk of complications, they have compared this in pregnant women versus non-pregnant women, you know, age matched for other problems, and there has not been a difference. And so we've got a fair amount of data on that now, actually, as well.
Anything else to add, Dr. Foughty or Broadwell?
I would just agree that I haven't seen any complications in any of my patients.
Sure. Okay. So I know that we kind of like touched a little bit about the ability to conceive, but just kind of like to make it a little bit clear and crisp. So has there been any correlation between COVID vaccinations, getting COVID vaccine, and the ability to conceive?
No, there has been no detrimental impact, and that has been supported by the American Society of Reproductive Medicine, the American College of Obstetrics and Gynecology, and all data thus far. We do not see any increased risk of developing infertility, you know, either in the near or distant future with receiving this vaccine.
Sure. Anything on your side, Dr. Tobiasz or Dr. Foughty?
No, I just want to echo that. There's no data to substantiate that, and you know, when you look at the things that are being stated about why people say that would happen, that would be true if you were sick with COVID as well. So, and we have not seen increased rates of infertility related to COVID infection or for women or with the vaccine.
Sure. Sometimes a lot of pregnant women might be hesitant because the vaccine has not been really fully and completely tested in pregnant patients. So what does the evidence tell us so far, and how have you seen that in your practice or you know, even in the literature?
So I would say so far the evidence is very reassuring. We have quite a bit of observational data now through the VSafe and CDC websites, as well as the animal studies that had been done previously, as well as just general knowledge of how the vaccines work. Both of the mRNA vaccines, there's no component in the vaccine that would be concerning during pregnancy. The mRNA does not change your DNA or anything like that. So it's not like it's changing your genetic background or anything like that, or even the risk of it getting to the placenta and traversing directly to baby would be a negligible risk. It would be degraded before it ever reached the fetus. So I would say overall reassuring. With the Johnson & Johnson vaccine, there have been studies with using the same vector that is used for the COVID-19 with both HIV and Ebola. They have studied that in pregnant women, and there have not been safety concerns. So using data from other vaccines using similar methodology, I would say there should be no concern.
Okay, thanks. And anything on to add beyond that, Doctor? Okay.
I think the only other thing that, and perhaps this is maybe well known, is that really they've been working on mRNA vaccines for decades. So this is not a new development just for the COVID-19 vaccination. It's been developed and studied in multiple other viral infections. And with the onset of the pandemic and the international need for this, I think a lot of resources were pooled to sort of focus in on this method and to make this happen. But it is based on, you know, the foundation of years and years of research. And so I think that also is a reassuring thing.
Sure, great, thanks. It is just a follow-up question, and maybe Dr. Tobiasz, you kind of touched on that. But if the pregnant woman gets the vaccine, does it transfer to the fetus, or does the fetus get immunity or is affected in any way?
So the vaccine components themselves would likely not transfer through the placenta, but we do know that the immune response that mom mounts, some of those antibodies are crossing, and that has been demonstrated now with multiple studies. Whether or not that gives baby protection is yet to be determined. We don't have that answer, but both in umbilical cord samples after delivery, testing the baby after delivery, and even in breast milk, there has been some antibodies, and there's even some suggestion that the antibody response in pregnancy is better with the vaccine compared to those that had infection. When you look at the levels of antibody, that doesn't always mean that there's a difference in response, but the levels of antibodies were actually better with the vaccine. So, yes, the antibodies cross the placenta, but the vaccine itself should not.
Okay.
I think you're muted.
I am muted. Now I am not. Thank you very much. So another follow-up question to what you shared with us, Dr. Tobiasz. So if a pregnant woman is expecting a girl, for example, and the mother-to-be wants to get the vaccine, is there any concerns related to the reproductive future of her soon-to-be daughter?
There should not be any concern, just given the fact that with the way these vaccines work, they really should not be crossing the placenta to directly get into the baby system. And then we also have the reassuring data that we haven't seen increased rates of infertility in, adult women that have gotten the vaccine. So I would say based on that data and just how the vaccine works, highly unlikely.
Sure. Okay. And is that also Dr. Broadwell or Dr. Foughty, is that your experience through literature and clinical practice?
Yes, I would agree with that.
Okay.
Absolutely.
Sure. So now talking about fertility treatments, is there any correlation or any effect to COVID vaccine that affects the treatments or the effectiveness of how these treatments are ongoing, or IVF or something of that sort?
Yeah. I can say, in my clinical practice, we have seen no kind of impacts of vaccination on responsiveness to medications, on ability to complete cycles. I think the one caution that we have at the American Society of Reproductive Medicine has also made known is that sometimes there can be a fever and there can be symptoms following the vaccination, and that this is something that we would prefer to avoid around the time of certain treatment cycles, as sort of that response fever with the vaccination may be complicated by the fact that was this also due to the procedure that we just did. And so if it is at all possible, if we can avoid vaccination and the potential post-vaccination fever or myalgias that may follow, to kind of help make it less muddy, to see if those if that reaction is due to the vaccination or the procedure. So I think if we can time them separate from that reproductive procedure, it's not that it's harmful or not safe to do it, it's just that might complicate. Do we have a complication from our procedure that we just performed, or is this a response to the vaccination?
Sure.
And in general, they recommend kind of 3 days, at least 3 days delay from vaccination to any procedure, such as an intrauterine insemination or IVF procedure, to make sure.
Sure.
Or surgery.
So you would recommend that that they take the vaccine 3 days prior to that treatment, or probably after the treatment is done, then they can go ahead with their vaccination.
Yep. I would say ideally, I think in general, if, right, it's the second vaccine and this is sort of a time-sensitive procedure, I think it's not a hard stop, but it is something that we just want to make sure our patients realize that it can, a fever following vaccination, we would just want to make sure that we weren't missing anything else that our procedure may have caused any complication like that.
Sure. Okay. So there has also one of the questions that we received is whether there is any studies or any proof that COVID itself has any effect on the weight of the baby. Are there any indications one way or the other, or some preliminary observations?
So to my knowledge, there's not anything on the weight of the baby. There has been associations with COVID infections and increased risk of preterm delivery, which of course, if a baby is born earlier, it's going to be smaller, but not that a baby would necessarily have low birth weight for where it is in a pregnancy. There's lots of other complications that COVID can cause to women in pregnancy, but to my knowledge and what I've seen in literature, I haven't seen anything about low birth weight.
Sure.
Yeah, I would support that as well. Most of the lower birth weight is related to earlier delivery. And the other thing to clarify is that women that are delivering early related to COVID, it's not necessarily because of COVID. It may be other factors that were going on. And the other thing is as well, sickness itself can increase your risk of delivering early. So it's not necessarily COVID specific. But we have not seen problems directly related to the fetal health from COVID infection.
Sure. Okay. Has there been any guidance or rules or advice from the American College of OBGYN or the American Society for Reproductive Medicine when it comes to COVID vaccinations, maybe kind of what their recommendations or what their guidance is?
Yes, so right now they say that pregnant women and women considering having children or conceiving should have access to the vaccine. That pregnancy is not a contraindication, and that's pretty clearly stated. So as far as timing of when to get the vaccine, in any trimester, I get a lot of questions about, well, should maybe I wait till the third trimester so the antibodies pass better to my baby like we do for other vaccines? And at this time I would say no, because our goal is to prevent sickness in mom. So the sooner mom gets the vaccine, the better, because ultimately, we want to prevent mom from getting sick throughout the whole pregnancy, not just the third trimester.
Sure.
And I would just add that both the American College of Obstetrics and Gynecology and the American Society for Reproductive Medicine also carry those recommendations through women who are breastfeeding. They also feel that women who are breastfeeding and approach vaccination the same as anybody who's not breastfeeding or pregnant.
Okay. And has there been any studies whether the antibodies are transmitted through nursing babies or not?
Some of the antibodies are present in breast milk. Whether or not that gives baby protection is not known yet. Sure. But yeah, they have detected the antibodies in breast milk.
Sure. Good. So one other question that is might kind of like also make some individuals hesitant is whether the vaccine, COVID vaccination, affects menstrual cycles, makes it more painful or stronger or anything of that sort. Has there been any studies or any correlation between the vaccine and menstrual cycles intensity?
Yeah, I think I am not currently aware of any studies that have kind of looked at that incidence of changes to menstrual cycles with COVID infection, the vaccine versus other situations. But I will say that it is kind of not uncommon for menstrual cycles to have variations following kind of febrile illnesses or kind of any other sort of physical, sometimes even emotional stressors can cause disruptions to an otherwise normal menstrual cycle. And so I think anything outside of that kind of normal expected variation is not, to my knowledge, been known or studied.
Okay.
And it's important for patients to know too that if you do get a vaccine and you have an abnormal menstrual cycle, this should get better on its own. We're talking one abnormal menstrual cycle. You know, if somebody is experiencing recurrent changes in their menstrual cycle, that's a time to go in and see your physician or your advanced practice provider, because the chance of that's not from the vaccine. You have something else going on.
Yeah, sure.
Look for the pattern. If the pattern changes, that's when, yeah, we can look into that. And
Okay.
I think there's other things that we realized, right? Kind of even post, I think, the quarantine that has happened, weights have changed throughout this process. I think in general, we've seen increase in weights that can also impact menstrual cycles, other stressors that are undoubtedly impacting people as well, that need to also be considered.
Sure. Okay. So one question, although it is kind of still now very recent, but with the Delta variant now becoming more prevalent, has there been a higher level of complications or a higher level of sickness that is happening to pregnant women in particular, or that is affecting those who are expecting?
Locally here, I have not seen that yet, but there are throughout the world, yes. And I have colleagues throughout the country too that now they state they have another resurgence of pregnant patients with COVID, where for a while numbers were going down consistently, and now again they have people that are testing positive and need to be quarantined and stuff when they're coming in for delivery and sick with COVID. So yes.
Sure. Okay. Okay, so probably we have kind of like time to kind of like I'll ask you if you have any additional thoughts or advice when it comes to COVID vaccines, fertility, pregnancy. If you want to summarize your advice or your kind of like what your guidance is for us, for our audience, what will it be? And maybe we'll start with Dr. Foughty.
Okay. So I strongly recommend getting the COVID vaccination, regardless of current pregnancy, future plans for pregnancy. Everything that we have evidence-wise is indicating that the vaccine is significantly less risky than the COVID infection itself. That being said, if you have questions, go see your physician, go see your nurse practitioner, go see your physician assistant. They're the people that take care of you when you're sick, when you have these issues. They know you well. They can go through that information, and don't be afraid to ask them and bring your concerns. That's, all of us here, that's what we do. We talk about these things, and we want to make sure that you're comfortable with your decision, but we also want to make sure that all of our patients are healthy, but especially when we're dealing with two patients, mother and baby, we want to make sure that both of them have the best chance of the best possible outcome.
Sure, thank you. Dr. Tobiasz, what's your message?
My messaging is the same. Get your COVID vaccine. Pregnancy, not pregnant, breastfeeding, get your COVID vaccine. These are very, very safe vaccines.
Sure. And Dr. Broadwell.
Rounding it out. No, I think I absolutely agree as well. And I think I can understand that people are scared, people are nervous, and I think that sometimes there's information that can be helpful and some that can be somewhat misleading. And I think it's just really hard to digest all the information that is out there, and stories that are kind of filtering through that maybe even come from trusted resources, and it's confusing. And sometimes I think the reason to get a medical education today is to figure out what information is actually sound and what information is just scary. And so I think it's really hard to navigate all that. So yeah, I very much stress. I enjoy talking with patients about this process, and I absolutely recommend vaccination for all individuals. I really see no evidence that this risk to fertility or their future fertile potential, there's just no evidence that that exists. And I don't even exactly know where that all came from, but I think it's important and don't be afraid to bring those questions. They're not dumb questions. They are very appropriate questions that we are here to kind of help you with. And even we don't have to 100% agree on everything that we're speaking, but that counseling is very, very important. And don't fear that thought that I'll be upset, or that your physician or physician assistant, mid-level provider will be upset about asking these questions. We're here to help you navigate that process.
Sure, thank you. So kind of like what I gather is like there is a lot of information out there, some true, some not, but the best source of correct information would be your provider. Go and ask your provider what works best for you, and they will help you navigate through your situation and provide you the proper advice that works for you and for your health. I do thank you very much, Dr. Anna Tobiasz, Dr. Stephanie Foughty, and Dr. Christina Broadwell. Thank you very much for giving us your time, your expertise, and sharing it with our audience. And for our audience, thank you very much for joining us. And till next time, take care of yourself and have good health. Have a grand day.